having taken that into account, you're cured. After 5 years, we declare a patient as cured. But is anyone cured? Do you know, even sitting in this room, between 5 of us, we have one or the other cancer lying somewhere, which has not shown up because of our immunity or our balance. So wherever the balance goes a little haywire, the cancer develops. So first of all, none of us knows when and where it will happen. So that takes care of the part 2 of the story. That is, why bother about it when it can happen anytime? See, the trouble is, once you remove the trigger, the chances of other cells, which we call as stem cells, we call them stem cells because from these cells stems out, variety. So you can develop muscle from it, you can develop bone from it. हम actually original हमारा वहीं से एक cell जो कि stem cell है, which is a cosmic unit if you look at it this way. Because अगर आप इत्तेफाक है या क्या है, 75 to 80% of the universe is water, 75 to 80% of the body is water, 75 to 80% of the cell is water. So if you know the cell, you know the body. So the same old जो ईश उपनिषद का जो उद्घोष है ना, from the whole emerges the whole, yet the whole remains, तो यही है. तो उसको हम पूरी तरह से तो कभी भी नहीं निकाल सकते. इतना ही हमें मालूम है कि एक ट्रिगर है जिसको हम ईस्ट्रोजन बोलते हैं. Now women have estrogen dominant body, men have testosterone or androgen dominant body. If you take away, that is how we are created. So if you take away estrogen, you will have all these symptoms, bony pains, because estrogen is required for your body, quality of life, as you were saying. These stem cells are waiting to get triggered. So the moment that estrogen stimulation happens from wherever, therefore obesity is a risk factor. Obesity इसलिए risk factor है कि जो peripheral fat होती है, that converts into estrogen. You're doing exercise, you're fit otherwise, that's why you're fine. You won't have recurrence, I can assure you. But I should stop any trigger points. Now how do I stop it? One option I have is have no breast at all, so there's nothing to trigger. So that would have been mastectomy. So if we had done mastectomy on you, maybe I won't require any of this because there's no breast left. Then I'll be targeting the other breast. I would be just thinking about other side, you should not develop it. ये भी एक issue है, ये भी एक risk है. उस risk को देखते हुए estrogen, क्योंकि आप उस पे जाइए ना, why did you get it firstly? Why did you get it and somebody else did not get it? The reason is some trigger somewhere. Otherwise cells are the same. So we are just trying to take care of the trigger after having removed the demon. When the demon is out, every drop of it, वो रक्त बीज का हर blood हमें कहीं ना कहीं गिरने से रोकना है. So what estrogen inhibition can do is, it can prevent it forever in the contralateral breast as well as in this breast. अब estrogen को stop करने के लिए अगर आप pre-menopausal होते हैं तो एक थोड़ी सी relatively less troublesome drug है tamoxifen, which is cheaper, better, and we used to give it to all patients in the past because we had no other drug. This drug has a very significant impact on endometrium, that is uterus lining. It starts overgrowing, so there can be a chance of endometrial cancer. While you are protecting this, you are developing this is modulating. But इसका एक बड़ा significant advantage होता है, it causes calcium deposition in the bones. So bones weak नहीं होती. Aromatase inhibitors does not produce endometrial cancer, but it takes away the calcium from the bones because estrogen खत्म हो जाता है तो bones में deposition खत्म. We are taking care of calcium deposition by giving you some other drugs like bisphosphonates, etc. So this is a better drug to give for a post-menopausal woman because ovaries are not functional. अब आपका peripheral conversion है. For peripheral conversion, an enzyme is required which is called aromatase. So we give a drug which is aromatase inhibitor. सारी drugs जो letrozole and estrozole जो आपको जितनी भी रखी हैं सब उसको block करते हैं. 3 years if you give it, it has been observed in studies that after 3 years you have done the job. तो इसके 3 साल complete करके we'll switch on to tamoxifen, so quality of life would return. That's a middle path. So answering your question, QOL or the quality of life is our primary aim, no doubt about it, because they are living. Without life, there is no quality of life. True. So first we'll ensure that we cross that 5 years barrier. After that, the chances of recurrence drop drastically. Then we can play around and do that kind of an experiment. But till 5 years, I cannot do it.
The good sir talked about mastectomy. Now mastectomy is now that particular thing where it came out and we have reduced that, we have removed that. But the question is, as you rightly pointed out, the cancer cells can happen anywhere.
That's why, that's very right. That's why we can do with less than mastectomy. That is how the concept of breast conservation came. Because with or without it, we will still
My
have.
My question was that you said that if it was not there, we would have stopped medicine. You would not have done it.
No, I didn't say that. What I was saying was.
I misunderstood.
Yeah, no. You probably, I didn't put it across properly. There is a trigger point, there is a trigger, and there is a receptor.
Right.
I was saying if there were no receptors, then probably you could talk about it. I'm not talking about it because there will still be receptors on the other side. So this is more for the contralateral side than for the local side that we are concerned now.
Another very stupid thing I may say. Suppose we remove that particular thing now. Does it stop? Can we stop the medicine?
I just told you that. The answer is in the previous statement. That is, we are also concerned about the previous. See, your quality of life will improve. You will be fine. And let me tell you, there are certain bony problems which are there also because of your age. They are not always related to what you would have had some arthritis around this time. Anyway, now we will be linking, we are trying to put every egg in the same basket. It is possible. Like होता है ना जब कोई समस्याएं आती है तो सब एक जगह पे डालिए इसी की वजह से सब हो रहा है ऐसा नहीं है. You just stop thinking about it. This bony problem is very minor. And let me tell you, with or without this entire jiggery pokery, you could still be having that bony issue. There are many people without breast cancer and on treatment who also may have bony problems. So it is a minor thing to pay. Finally, my concern is not about local recurrence. My concern is about distant failure. It shouldn't go anywhere. It would not go anywhere. And we are hoping it's one of the better cancers because it is responsive to estrogen. ER/PR positive cancer is a good one. Do you know now 1 in every 10 women is getting cancer, 6 amongst 10 women are potential candidates. The moment the lifestyle changes happen, any change in the hormone, they get it. So we're getting lots and lots of these cancers. So take it as another disease which is happening to everybody and it happens all the time. You will live your life. I've treated patients who got second cancer after 15 years. उनकी उम्र 85 ऑलरेडी है तो कहते हैं आप क्या करना है मैंने कहा इसको भी ट्रीट करें तो इट्स लाइक टेक इट इन द स्ट्राइड. See, the other good news is this is a normal breast now. This side is also normal, and we want it to stay normal. After 5 years, whatever experiment you say, I'll be trying to do that. Otherwise, I can't take that risk with you.
Another question: suppose it reoccurs, is it more deadly or deadlier or deadliest than the before, or it is yet to be seen?
It's a very good question, and I must let you. I mean, you're thinking absolutely correctly. Anything that recurs is a worse cancer than the one that started. That's why we don't want recurrence. In this also lies the answer.
Right. That's why we are prepared.
It's not the same cancer that you get first time. Why? Because it has already developed some kind of a resistance to the kind of therapy you already provide to the patient.
It comes back stronger.
So, let's talk about today. आज इस वक्त आपको कोई कैंसर नहीं है. हम सिर्फ किसी और कैंसर के होने को अवॉइड कर रहे हैं. In 5 years, we may stop everything also. And after 3 years, we can think of switching over to tamoxifen. But as you will understand and appreciate, this drug will act better than tamoxifen any day because this is acting on the very enzyme which we are concerned about.
Right now, switching to that particular would be catastrophic?
Not really. It will be 50-50 advantage. So advantage would reduce. No. We will stick with it. and we'll hope for the best and you'll be fine. Don't worry about it, don't think about it.
कैल्शियम डिपॉजिट तो नहीं रहेगा नर्व्स वगैरह में कि इतना 5
ये कैल्शियम डिपॉजिट वहाँ ऐसा नहीं होता कि वहाँ से निकला और फिर वो कहीं और जाके जमा हो
She is taking extra calcium which she is taking.
एक्स्ट्रा कैल्शियम आपको पता है एक चीज़ जो आप लेते हैं, बॉडी का सिस्टम इतना इंटरेस्टिंग है कि जब तक उसकी रिक्वायरमेंट है तब तक ही एब्जॉर्ब होता है. कैल्शियम एब्जॉर्प्शन इन द गट इज सेल्फ रेगुलेटरी. यू कैन नॉट एब्जॉर्ब मोर कैल्शियम. अगर आपको हम 5 किलो कैल्शियम खिलाएंगे तो भी 2 ग्राम एब्जॉर्ब होगा, बाकी नीचे निकलेगा. Our body is much smarter than we think.
So she was worried about calcification which leads to heart clogging and all that.
One problem with that, tamoxifen is the cardiac problem. With aromatase inhibitors, that's not a problem. So most common cause for calcium for deposition is here. Take it off your head. Don't be under any kind of a stress. And don't think about recurrence. We discussed it, but that doesn't mean you think about it. इसको भूल जाए, आप अपना नॉर्मल काम करें जैसे रहते हैं. और इस एज में वो पैर वैर में दर्द और ये सब चलता है, इसको लेके ही चलो. Drag the pain along and pain will go. Is that okay? No other question?
Another thing, she is still teaching these small kids.
Continue.
She at times says that I feel tired, and she is calling some, EWS kids at home also. So should she stop any of the
Don't
either
stop.
of the activity or taking rest? Because by the time she is trying to get some rest, 5 o'clock, the kids come.
No, timing
The-
readjust. You can readjust the timing. Make it in such a way that you don't get